Well, hello everyone. Glad you could join us tonight. This is great that we've got Dr. Mindy. That's her name around the office. So she's a dentist and she's got years of experience of working with lasers. And the last little bit she'll explain, but she's talking about how she's been able to incorporate light, in this case, light as photobiomodulation, that is red light technology into her practice. So I'll just show you that. So we this is going to be a fantastic webinar. I'm glad you guys could join us. So one of the things with our also our webinar is we have a Palm Ultimate, and the Palm Ultimate is something we give away once a month. And if this is your first night, you get 1 ballot put in. If you've watched us for the last 4 weeks, you get 4 ballots. So every time you tune in, you get a ballot. This is a $1,300 device. And it has the red, the very, very powerful red. You can see it coming right through my hand there. I'm just blocking the light from the ceiling here, but you can see how it's going right through. And then there's the near infrared, which is this wavelength here that you see, and that penetrates much deeper. So this is the device that we have, and it's somebody is going to be is going to have a great time finding out that they won this device. So please remember to tell your friends to join. I know that weakens your chances to win just a little bit. No, but think of all the people you can help if you told others that we have this webinar going every Tuesday night. So please tell your friends to join in. Also, please go to our YouTube channel, it's not our regular channel is www.sunpowerled. And that's our .com. And also, if you want to go to our YouTube channel, there's a lot of extra videos there, and it's SunPowerLED. Just search for that. And when you do, please like and subscribe. Now, the subscribe portion, that allows you to be first on the list. That you'll be notified through YouTube that we've popped up a new video. And you can know then when it fits to watch it. That's one thing. Second thing, if you click the like button because you like it, that really helps us. And I need everyone that's watching tonight to help us, because we need to get this word out. It's very, very hard to do that, especially now with so many very low power red light devices. We need to get out that our device is something that really can penetrate into the body and help for reducing pain and inflammation. So we'll get into that. Also right now we got a site-wide discount of 10%. So if you go to our website right now, you can receive 10% discount. It's a short time period, but we're going to have a sale of 10% for everyone who buys some product in the next within the next week here. So please see our website. If you like to get some product, good time to do it. So now we'll go to a video that we have, and then we'll bring on Dr. Mindy.
15 years back, I realized that light could make a huge difference on the body. I ended up designing this very powerful light using LED technology. With this amount of very high power density, it can reach through the tissues and travel right to the joints. But the key is that the power density and the area is extremely important to deliver that light into that. The mitochondria receives that light and converts that energy into the cell. So it's like giving the cell super high octane fuel, and they run like a jet, and they're able to do all the things for repair in that. What are the products we have? Well, we have a small device which is actually large when it comes to light therapy. You have a fairly large area of light and a high power density that can be used for different parts of the body, like your fingers, shoulder, back, neck, knees, ankle, anywhere on the body. And then we have what's called the mini canopy, which is about a foot square in size. And then we have our full-size canopy, which is basically 6 of the mini canopies. And then we have another device, which is the helmet, and that device can help for mental issues, for brain injuries, for concussions, for PTSD, TBI, all of those kinds of things. And there's new research out there that shows it could be helpful for not only strokes, but dementia, Alzheimer's, and Parkinson's, and just different brain issues. Our plans are to move this technology into every area of the world where there's pain and inflammation, which is basically everywhere, and to expand that so people understand all the applications where this technology can be used to help them in their health in the body as a wellness device. People are looking for how they can treat themselves without drugs.
All right, so now we're going to have Dr. Mindy on. So Dr. Mindy, if you could turn on your video. So Dr. Mindy will fill in a few more details in a moment here, but it is fantastic to have her on. She's had a ton of laser experience over the years, and now in the last year and a half or so, she's been able to experience the SunPower LED product. And so Dr. Mindy, thank you for coming on tonight and sharing your experiences. So first of all, how did you think you connected or figured out about it, found out about us?
Thank you for having me, Tom. I have a hard time recalling, but I believe it was a couple of years ago when I began my search for more powerful red near infrared light devices. I heard you on an interview, and I believe it was with, there's a guy named Alex out of Australia that does a lot of work with photobiomodulation. And I believe that's where it was. And I got on, looked into your devices, saw how powerful they were, and immediately ordered 2 Palm Ultimates, and the rest is history.
Right. So fantastic. So you ordered the units, and that was for at-home use, or what were you thinking at the time when you found out about us and ordered?
A little bit of both. I had anticipated having both units at my office, but I ended up keeping one at home because I realized how amazing it was for aches, pains, and injury healing. Well, I'll talk a little bit about that in my presentation, but it's been a game changer for my husband and I, our kids, and yeah,
and so you've been in, do you remember if once you saw it, you right away ordered it, or you watched some of our webinars, or what did you do in your thought process for the research?
I am a pretty big researcher, so I was looking at the power of it, looking at some of the reviews. I watched some more videos. I believe I watched a video or 2 on your site, and was doing a lot of comparative analysis with some other devices. And yours, the size, the treatment size, and the power that comes out of it are what really got me with it. And I no regrets. I'm so thrilled that I stumbled upon you when I did.
Well, I'm thrilled you stumbled upon us. That's great. That's great. So as far as you watched, now you've been able to watch a few more webinars. Any webinars stick out from your watching of a few of them?
Some of my favorites, I believe you've had her on twice. She's a researcher on the East Coast, Margaret Naser, as I believe.
Yes, Dr. Margaret Naser. She's fabulous.
Yes, I absolutely loved her research and detail. I love to know all of those details and the things that she's been doing, and she's been at this for some time. That was amazing. Those were amazing.
Yeah, she's done beautiful stuff for brain research as far as to help with concussions, or as after you have so many concussions, you end up with I forget encephalopathy or so. I can't remember exactly,
Chronic
but
encephalitis. Yep.
okay, yeah, and she's been able to help in that research, and she also was able to experience the light. She used it for her eyes to help her eyes, and was able to improve a vision problem that she had. So that was pretty neat as well. Any others in particular that stood out? But that was she's definitely one of the lots of people have watched her webinar.
Yeah, that one was fantastic. There was another recent one too that I saw the recording of. I believe she's a neurologist. I cannot recall her name right now. Blonde hair.
Oh yes. Okay, Dr. Wendy Bessler.
Yes, yes.
Oh
yeah,
yes, a psychiatrist.
Too. Yeah. I find all of that stuff very, very interesting. And I mean, the stuff with Parkinson's and everything else, it's amazing. It truly is amazing.
Yeah, so I think it's a good time well, yeah. So as a matter of fact, I just seen that she popped on. So thank you, Dr. Nasser, for I think you just popped on. So Mindy has been talking about your webinar that you did with me, and all the work that you've done. So anyways, yeah, so okay, what we'll do is now we'll go into the into your slide presentation that you have. Okay, all right, go ahead, Dr. Mindy.
Okay, so I put together some slides just because I find for me visual aids are very, very helpful. And I just wanted to kind of summarize how I'm personally using it in my practice, and then I'll talk about at home some of the things we've done with it as well. But I have a light scalpel CO2 laser, which is one of the best lasers in the business. So I do a number of tongue tie releases, lip tie releases, things like that. And when we release these fascial tension, when you have a tongue tie or a lip tie, the frenum, the little piece of connective tissue that attaches the tongue to the floor of the mouth, is very, very tight. So the tongue can't move like it needs to. Then we can't swallow like we're supposed to. We can't rest with soft tissue balance like we're supposed to for proper craniofacial growth. And it can bring a lot of head and neck tension for people. And with the tongue tie release, it's never something that you just want to release the tissue and go. It requires oral myofunctional therapy to help get that elasticity, regain that function, help it heal ideally. And whenever you do a surgery, you know, we have the initial phase of inflammation. That's the first couple days when it's uncomfortable because there's swelling. And then it goes through a phase of wound contraction and things get tighter. And I don't want that. I want things to be as elastic as possible. So I like to do anything I can to enhance healing. So I have my patients do oral myofunctional therapy really well. And the addition of photobiomodulation has been awesome. I like to do a little bit both preoperatively and postoperatively to activate those mitochondria, get everything ready to heal. And my best results are when patients can do it, have a device at home that they can do it regularly with at home as well. But these, just to give kind of an idea of what a tongue tie looks like, this is an anterior tongue tie. You can see how tight that is right there. The tongue cannot elevate well. Immediately after surgery with the stitches in there, that's this picture. And then just 1 week out, we've gained a lot of motion. And then as things continue to heal, we continue to gain more. And again, the photobiomodulation has been a game changer with this because it helps enhance that healing so much. But same patient can only stick the tongue out this far. Right afterwards, when we're still numb, we're getting further. And then look at a week out, we really gained function for these patients. This is another patient who had a posterior tongue tie. So it was underneath the mucosa. You can't see the string of tissue here. It was underneath, and these pictures are not good quality. My apologies for that. But there's a lot of tension, a lot of asymmetry, and going afterwards, we have so much more so much more range of motion, so much better function and symmetry. Again, another one, just giving an idea of how we can regain that. And again, the photobiomodulation has been huge for the healing stage, and the healing stage is such a big part of everything. So I'm finding that to be so useful in my office. I have the Palm Ultimate device here, which is fantastic. I'll talk about some specific applications that I love to use that for. I have a smaller device too, the Light Path LED diesel torch. It's a great device. It's strong, but it's not nearly. I mean, this we've got about 6 centimeters squared of treatment area, and as compared to 40 here. So it's just night and day difference with the two devices. Both serve their purpose, but again, the Palm Ultimate has been my go-to. TMJ dysfunction is, I treat a lot of TMJ patients, and the Palm Ultimate is amazing for this because it covers such a large surface area here. There are so many things that that are behind the discomfort that patients are having when they have TMJ issues. It may be in the joint space. The cartilage disc may be displaced. It may be inflammation in the joint. A lot of times there's also some muscle issues, some muscle activity. The pairs of muscles are working out of balance. They're overworking at night, and they can become very sore. The things that lead to a lot of the dysfunction with the TMJ is instability of that lower jaw. When we've got a weak tongue that's not able to rest up appropriately on the palate and keep that lower jaw stable, that lower jaw falls open a lot more. And that whenever we have instability of that lower jaw, that's when we're at risk of having the clenching, the grinding, those muscles starting to fire out of order. So the nice thing is when we can get some of that anterior temporalis muscle, some of the masseter muscle, as well as the joint space and the little lateral pterygoid muscle that tends to be a problem. When we can hit all of that in one 4-minute session, I mean, what I find is that 1 minute of red and then 3 minutes of near infrared brings so much relief to these patients. And some of them that are having a little more intense, sometimes we'll do 2 minutes of red and 6 of near infrared. I find about 1/3 to 2/3 tends to be a really good combination. But I mean, this covers so much ground, and it's so nice. The less of a time investment, the better. The more likely patients are able to do it. Whereas if we've got something small like this, yes, this is a powerful device. But for me to get that same treatment area, I need to hit about 5 different spots. And this is a 6-minute timer. So now we're looking at 30 minutes rather than 4. So this has been amazing. My TMJ patients that I treat, I love to use this in the office when they're in. Even some of my restorative patients, you know, when patients come in and they have a lot of work that I have to do and they're open for a long time, this little lateral pterygoid muscle that I'm circling right now, that's the muscle that holds our jaw open wide. And so those get so tired after being open for so long. And patients will oftentimes, especially patients that are prone to TMJ issues, they'll have a lot of discomfort after being open for so long. So we have a long restorative appointment. I keep them in the chair afterwards. We get out the Palm Ultimate. They do 1 minute of red, 3 of near infrared on each side, and they feel so much better post-operatively. So I find it to be a big time game changer. Another thing that this is helpful with treating with that tongue instability, with the instability of the lower jaw, the highlighted muscle right here, the posterior and anterior digastric muscle, that's one that tends to be tense, very, very tense in people who do a lot of clenching and grinding. And just putting the head straight up, shining it under here, shining it over here, that helps relieve some of those over tight muscles that are pulling that mandible down and back. there are so many applications I could talk about with this, but I'm going to try to stick to some of the main ones. Another thing that I do a lot of in my office is craniofacial development, developing the jaws, the mid and lower face of patients. A lot of kids, but adults as well. And if you look at my little skull here, the maxilla, that upper jaw, it's the whole center of the face. And so when we work to develop that upper jaw, we can see some changes in that entire mid face there. And the more that I can enhance that expansion, the more awesome results we can get. When I am moving teeth, the way that teeth move is they develop the bone around them. There's a little ligament that runs around the root, the periodontal ligament, and the bone remodeling cells, the osteoblasts, the osteoclasts live there. And activating those with the pressure of light orthodontics, activating those even more with some red near infrared light, that really helps enhance that bone growth and development to allow the teeth to move. So I can take adults with very collapsed arches, not enough room for the tongue to live in there, a lot of extraoral tension. I mean, you can just see the preoperative extraoral tension. And with some slow progressive orthodontics, move out into a nice broad smile. That relieves the whole face. It helps to relax the whole face because now the tongue has space. The lips can relax. Everything else can relax around it. And you know what enhances that a lot? Again, the red near infrared light helps this movement and bone development happen so much more efficiently. Right now, I have my orthodontic patients use a BioLight Guardian device that goes in. It's red light. I think I need to charge this, but goes in the mouth while they have their aligners in or their light wire expansion appliance in. And it's got a 16-minute timer on it, and that helps enhance that orthodontic movement so much. And I'm very excited because I had gotten wind that Tom had created an intraoral device, and he just actually showed it to me before the webinar. And I'm very excited about that because I have a feeling that's going to have even more power than this. So I'm looking forward to learning more about that. And I think that could be something that's very helpful with these situations. But just looking at this was big clencher grinder, a lot of constriction. In just 8.5 months with some clear aligners, we were able to move things out to where they needed to be and just do some simple bonding to get the teeth back to their natural form and a state of health. Same case, just looking from the palate, and just you can envision how much more space we have for the tongue to live inside that palate now. This is another one, 7 months of aligners, and we had very worn down anterior teeth. Orthodontically, we were able to develop everything out. We started here, we were able to develop everything out to make space. Now we can do just 4 crowns on the front teeth. Didn't need to do anything else, but that made a night and day difference in the smile. And again, 7 months of clear aligners to do that development to make space. And this red near infrared light, the photobiomodulation, helps enhance that movement so very much. It's amazing what can be done. Another case, 13 months of clear aligners, a lot of wear, a lot of constriction here, just worn down flat. We were able to make space to then bring these front 6 teeth back to their regulation size again. This was a case, this was a 2-year case, a little bit longer. I did a separate expander before the clear aligners, but this had been a patient with a lot of TMJ issues, a lot of TMJ discomfort. With the help of photobiomodulation, with the help of a tongue tie release, with the help of some good TMJ care, we were able to really develop out to nice broad arches, and TMJs are feeling amazing now. That tongue can fully rest up in the palate, and that lower jaw is so much more stable. This is just some images of showing how that bone can develop. If we can get those bone cells really, really working and developing, even in an adult, we can make some gains both side to side and forward. The SNA angle that we use to kind of measure where that upper jaw is sitting in the head, we like to see that at 82 degrees or bigger. You know, we started with this one, we started at just a little under 82, ended up at a little over 84, and that in an adult is something that you almost would think is unheard of, but it can happen. It takes some time, it takes some know-how, and again, the photobiomodulation helps. It helps so much. Skip through this one. This is an image, the three-dimensional image showing the jaw joints. This is before and after jaw joints with the same patient. In the before, the jaw joint is kind of a ball in a socket. The temporal fossa is what holds where the condyle sits. The condyle is what the mandible, the little ball at the top of the mandible that rotates, comes down, lets us open and close our mouth. And ideally, that condyle sits a little bit forward and has some good space in that joint. When it gets compressed backward, in this preoperative one, it is compressed backward. You don't see much space back here behind it because it is compressed back so far. When this happens, the disc gets displaced a lot. There's a lot more chance of muscle dysfunction, a lot more chance of discomfort, and this patient had been having a lot of that. After we completed that development, we developed that upper arch so nicely and forward, that lower jaw was able to start posturing and resting more forward. And so now in the after, you can see we have better superior joint space and better posterior joint space. We don't have that compression anymore. So from a joint perspective, she was in a lot better place after this. The other thing that I wanted to show you, we can kind of flip through that. Some other dental applications. After restorative work, after teeth need to have restorative work done, that's anything like that is a stressor. Just having decay on teeth is a stressor for the pulp tissue, for the nerve and the blood supply inside the tooth. And so sensitivity is a risk. Having some temporary sensitivity is a risk, and all of that. Photobiomodulation, that red near infrared light, helps stimulate healing within the pulp as well. It's great for pain management. It's great for reducing inflammation. Just generalized tooth sensitivity, it can be helpful with that. Again, for a lot of these applications, I'm using a more intraoral device like this or the one that Tom is making right now. But seriously, this palm ultimate is so powerful that you could even hold it in whatever area, or if it's all the areas, do a 1 minute red, 3 minute near infrared, 2 minutes red, 6 minutes near infrared, whatever you need. This can be helpful too, because this is so powerful. It can really penetrate. It can really help with that. Periodontal disease is an inflammatory disease. That's when you have a lot of inflammation in the gum tissue and the bone around your teeth and you start to lose bone. Controlling that inflammation, this is very, very helpful device for. My husband we're both dentists here. He does a lot of oral surgery and all that. Pain reduction, enhanced healing after oral surgery. Amazing how much photobiomodulation can help. Pain reduction and enhanced healing before and after root canals. Treatment of oral lesions, canker sores, cold sores, oral mucositis that's with some medications. Some people with stress have these responses, but this can be very helpful with A, reducing the pain, B, helping them to heal up a lot faster. Xerostomia, dry mouth, there are some medical conditions that cause that. There are a lot of medications that cause that. But I find even doing some treatment over the parotid glands, hitting the submandibular and sublingual glands from under here, hitting that, doing that, stimulating those can be helpful for getting some better salivary flow. And I even love the idea of nasal and sinus congestion. With this big device, you can hit straight over here, and you can even get over the maxillary sinuses a little bit and help with that a little bit as well. And then we talked about the enhanced alveolar bone remodeling and adult expansive orthodontics, but there are so many applications for this. The trouble that I find in the office is having enough chair time to be able to do it much with patients, and so I'm trying hard to get my patients to get some of their own devices, whether it be this one or any other one, and teaching them to be able to treat at home, because it's consistency is what helps with these things so often. I wanted to share a story too about last year. My son is a competition gymnast. Last year he was a level 6. This year he's a level 7, but last year he was a level 6. He was 10 at the time, and he had this injury that you just saw play through there. He was doing his floor routine. He came down and he had a pretty bad knee injury, hyperextended it, patellar tendon strain, posterior patellar contusion. I mean, it was pretty bad. And this was the beginning of the season, and we thought it was going to be a season ender for him. And we brought him to the urgent injury clinic, to the orthopedic surgeon's urgent injury clinic here that weekend. And he did all the imaging, identified all of the problems. There was some very bad inflammation going on. And sure enough, I had the Palm Ultimate at home. So Max hit that with red and near infrared, and he was doing longer treatments. I want to say he was doing about 5 minutes of red and 15 of near infrared, but he was diligent. He did that every day. And the next week came, and we got him into the sports medicine physician who works with their gymnastics team. And the sports medicine physician could not believe how little inflammation was left there. He had been at the meet and seen it happen, and he couldn't believe how much Max had already healed in that 5 or 6 days since the injury. And I really credit the photobiomodulation. I really credit the Palm Ultimate a lot with that. But yeah, it's wild what he does in gymnastics, and you see his rings routine right there. He actually this year had on the rings had a lower back injury, and we're treating it with the Palm Ultimate now too, and it's been a game changer. It's been really, really fantastic. And because his season was saved last year, he and his team went on and they ended up being regional champions, not just state champions, but they were champions of the entire region, which I think includes 12 states. So it was pretty fantastic. They swept first place in every single competition they were in, and Tom saved the day, I like to say. We go out to Colorado skiing and snowboarding a lot, and as I've gotten older, I've developed some bad habits, and I end up with foot cramping a lot on my snowboard. And it's enough that sometimes I don't feel like I can really go back out. And so now I keep a Palm Ultimate out in Colorado too, and it has saved a lot of snowboarding trips for me when my feet are cramping. I hit it with a minute of red, 3 minutes of near infrared, and I'm ready to go the next day. But you know, there are so many areas of health and healing that we can focus on. And I do want to say, I mean, red light photobiomodulation, this is huge, but we ideally have to have a lot of the other things in place too. I like to tell my patients, we need to return to factory settings. We need to be mindful of our nutrition. We need to be mindful of getting outside, exposing ourselves to natural sunlight, improving our circadian rhythm, the anti-inflammatory, nutrient-dense diets. There are so many things that we need to do. We need to work on our breathing. Humans have so often become mouth breathers, and breathing through our mouth is a stressor for our body. That in itself can create some systemic inflammation because it's a stressor for our bodies. So working to breathe exclusively through our nose day and night. Again, we've got nasal congestion, sinus congestion. This can help. You know, getting enough movement where we've become very sedentary, and again, getting outside and getting as much natural sunlight as we can, because we're under these artificial lights all day long, and that is giving our body the wrong signals for proper circadian rhythm, for proper melatonin production, for everything else. I put a few books on here that I think are great reads for overall health concepts. I mean, I have a bookshelf full of probably 100 books that I think are amazing, but I wanted to put these on there because these are some things that can help get some of the big points across. I do have a blog on our website, the Live Your Best Life blog, and I have put oh good, my thing worked. I do have a photobiomodulation blog on here too, that I'm known for talking a lot, and I write a lot, just like I talk a lot. But I talk about some of the different devices, some of the oral applications, and how they can be helpful with these different devices. Here's the familiar one. And then I also have that smaller device on here too. But these are all things, the more that I can help people understand concepts and understand ways that they can help maximize some things for themselves, the better. And so that's the whole point of this blog on our website. But that's what I've got. I hope I didn't move through it too fast. I hope I helped give some of the information necessary, but I'm free to open up for questions now if anyone has questions, or Tom, if you have anything else that you'd like for me to talk about, I'm happy to do that too.
The share. Okay, we just need to turn off the share slide and we're good to go. And what I'd like to do, Mindy, just for a minute, if you want to turn off your video, I'm going to just do a quick commercial break, and then we'll get right into the questions and answers we have here. Okay, so tonight we've been talking about all of the applications, so many beautiful applications used in dentistry, but so much more as Dr. Mindy was talking about home use, using it on different parts of the body. So the Palm Ultimate that she was talking about is the device that I mentioned at the first of our webinar. This is a $1,300 device, and we do have a 10% show special. I was just at a show, so it's come out as a show, no webinar special. So 10% off our entire website right now because of a spring sale that we wanted to do for like a week. So look at the light going right through. So it has no problem reaching into inner areas like hips and joints. And as Dr. Mindy was talking about her son, that's the red light at 660 nanometer. And then we have the 810 nanometer on the Palm Ultimate. Then we have the Super Palm, which is the other device, and it has the 660 nanometer wavelength and the 1050 nanometer wavelength, which has the potential to go a little bit deeper, and that's a $1,900 device. Also wanted to, I want to show one more thing. I saw that skull, Dr. Mindy. Thankfully to a very, very kind dentist who was able to allow me to get this human skull. And what people do ask is, can the light penetrate the skull? Well, let's see. There you go. Okay, so the light can definitely penetrate the skull, and we can help with all sorts of cognitive issues with this. And I showed the 660, but when you go 810 or 1050, there's even more coming through this skull by the fact of the wavelength being longer. So it's penetrating deeper. So that's what you can do for different cognitive issues. And one thing that Dr. Mindy has also mentioned about the inflammation on the, So this is our helmet. Oops, it's disappearing. There we go. This is our helmet, and this is 660 nanometer, and this is the other wavelength, the 810 nanometer wavelength, or 1050. It's basically 10 of the palm devices all the way around on the whole skull. And so we're able to go into the skull and help with all kinds of things. And very neat this past little while. I think I might have mentioned it in one of our earlier podcasts about the one girl with 10 to 15 seizures a day. And ever since the mother got the helmet from us, her daughter's seizures have dropped to an average of one a day. And she's actually made it through some days without even a seizure. So that's beautiful. We've also seen more recently, when it comes to autism, there's inflammation on the brain. And with our device, we can help reduce that inflammation. We're not talking about curing anything here, but if we can reduce the inflammation in the brain, it can help with conditions. So in this case, the young boy, 8 years old, was able to, was nonverbal up to 8 years old. And 2 weeks ago, 2.5 weeks ago, the mother got the helmet. And in 1 week, her son went from nonverbal to talking to his mother, and some other things. So it's very, very possible to help with autistic children in their situations. We saw that same thing happen for a 4-year-old, that after the very first treatment in the middle of the night that was done. And the only reason why it was in the middle of the night is because this child was so dysregulated, there was no way they could hold the light anywhere near him. So when he was sleeping, he didn't have much choice about the matter. His mother treated him, and then the next day he was babbling for the first time in 4 years, and within a week was saying some words. So it's quite neat. That's to do with those two brain issues. Third one we dealt with was to do with Parkinson's. And more recently, we have a video up on Parkinson's and how much improvement this fella had. So anyways, there's a lot of very good things that can happen with using our device, whether it be the palm device itself, on the brain or on the skull, and which goes into the brain, or using a helmet like we have. So I'm going to now ask Dr. Mindy to come on. And Dr. Mindy, I also have somebody else who's going to come on for a moment. Dr. Naser, she's on tonight. So you get a chance to say it yourself. Hey, there we go. Hey. Oh, you got to unmute yourself there, Dr. Naser. Okay. All right. There you go.
I think I'm here. Okay. Well, I guess you saw the note I put in there. Thank you so much for all your kind words. And if this disorder that the football players get is called chronic traumatic encephalopathy.
Thank you.
Or also known as CTE, and that's the best, the easier to say, CTE. And yeah, we published 4 ex-football players, and they all did very well. I mean, they were 55 years old, 57, 65, 74. I mean, they had played football 35 to 55 years ago, and they played football from 11 to 16 years. And starting with Pop Warner and all of that. So, and there's a wonderful research program now at the University of Utah in Salt Lake City, and it's part of Brigham Young University also, both powerhouse football teams, and they're using photobiomodulation. They're actually just published a paper to prevent inflammation in the brain after a full season of football. It's just remarkable. So yes, PBM can do a lot for prevention as well for the brain.
Thank you very much, Dr. Naser. So right now, Dr. Mindy, we're going to go through some of these questions. And stick around, Dr. Neser, because there may be one that I might have to ask you to answer if you'd like. Would you like to do that? Okay. All right. Okay. So let me just. Okay.
That, Dr. Nestor, I just have to tell you how much I enjoyed your webinars. I saw one main one with you, and then you were on another one as well, and I enjoyed them so much.
Oh, well, thank you. I think I'm just excited to see so many people interested in photobiomodulation now. I mean, I started way back 1984 or 85 through laser acupuncture, so that's really a long time ago. And I learned a lot of this in China. I lived there in 1985 for 2 months, so I've had a lot of exciting experiences with light therapy. Yeah. Thanks.
Okay, so Dr. Mindy, maybe you could mention that there's Michael asking, did you have any luck stimulating the mitochondrial regrowth of tissue for a bone graft and eventually a number 9 tooth implant, having the bone adhere to the adjacent implant? Just had that done.
Absolutely. So when you have a surgery, when you have a tooth removed and you have grafting put in there, that grafting is meant to be a scaffold for then the blood supply and everything to grow through it. Basically a scaffold for the bone for your bone to develop into. And the more you can stimulate the mitochondria in those bone remodeling cells, same bone remodeling cells that help me in my expansive orthodontics help my husband's patients in their healing after surgery, the osteoblasts and the osteoclasts. If you stimulate the mitochondria in those, that is going to help enhance that healing so much. So much. So I would absolutely recommend doing that. And then after the implant is put in, that bone has to form and fuse, reform and fuse around there. So again, going to be very, very helpful with the healing.
Yeah, I wished more dentists would know about photobiomodulation. I think it's growing now, but there's still so many that don't know anything about photobiomodulation, unfortunately.
There's a new ADA code for it now.
I heard.
So that's helpful. Yeah, there's a new ADA code for it now. 2 codes: the first 15 minutes, and then the 15 thereafter. So that shows some progress.
Yeah, exactly. First time with insurance to have insurance actually say that photobiomodulation is real, even though it's been real all this time. But finally there's some acceptance on that front, and I hope that more insurance codes start coming out. So if there's anybody in the insurance industry, listen up, that you need to do this, because you can shorten the treatment time, shorten the recovery time, and save a lot of money to the medical system if they use PBM. So all right. Okay, so Dr. Mindy, you mentioned about one device that we are, it's not out there yet, and it'll probably be about another couple more months, maybe longer. We don't know yet, but we'll see. But that's a new oral device. But people can use the oral probe that just snaps into the inside here and allows the probe. Oh, good. There we go. You got it. There we go. So that's how that works. That's an oral probe that can reach inside the mouth and different other places, so you can directly apply the light. So thank you for mentioning, showing that. I didn't have one handy. Okay, let's see. Can you use the helmet to reach TMJ areas by turning your head to the side, ear toward opening? Yeah, I mean, yes, you can, not a problem. You're going to blanket that whole area. As a matter of fact, one thing that if you happen to have a helmet, there we go. Okay, a person can rotate the helmet like this, and now they can literally do a facial. They could do a treatment for the jaws. They can treat the whole mouth area all at once. So that's very possible with the helmet. And as well, you're going to be treating your sinuses, your eyes, and everything. And Dr. Neser, did you want to mention, if you're okay with it, you could mention how you use the light? for yourself with your eyes, or you've
Oh,
read?
with my dry macular degeneration. Well, you built one for me. It was, sort of modeled after the Valida device where they did a lot of clinical studies, but it has in it yellow, near infrared. That's one button I push up on that,
Yeah,
handheld device with my eye closed. And the first is to do yellow and near infrared at the same time. And
yeah,
I only do it 30 seconds, and then I switch to red for 30
right.
seconds. And then I go to the other eye, 30 seconds, yellow and near infrared, and then red, 30 seconds. Then I start over again. For me, it was too intense to do a full minute
Okay.
with the red.
But you did see some improvement.
Well, it's holding steady, and I don't have any geographic atrophy yet, so that's the best you can hope for with dry
Yeah,
macular degeneration, and there's been no diminution of my visual acuity, so that's good. Yeah, I'm really
beautiful.
happy with it. Thank you.
Yeah, and we have had some people that have commented a couple. I'll have it up. It was a couple webinars ago. I had a 101-year-old on the air, and she used it, and she said the waviness in her eyes disappeared.
Mine is
And
just
so,
steady, so as long as it's not getting worse, then it's okay. But
yeah,
maybe I should use your just red and near infrared. I don't know.
yeah. No, I
Yeah.
think so. She just used the red near infrared, but I don't. I think the additional yellow could be beneficial, but for now, we've been able to see good results just with the red and
And
near
did that
infrared.
woman use it every day, every other
Yeah,
day, or
yeah,
what?
yeah, every day. Yeah,
Oh, okay. So I'm following this other protocol where you do Monday, Wednesday, Friday for 3 weeks, and then you stop for 4 months.
yeah, I
So
don't think
maybe I'll
so.
go back to a little more frequency on that.
I
Yeah.
do
Okay.
have with also wet macular degeneration, which is pretty rough, where the person stopped didn't want to do the shots anymore because of the pain. And her eyes, she was able to pain of the shot of the injection, and she's been able to improve her vision. And she's senior, and she's been doing it for a year and a half every day. So no problem there with using. And same in her case, she didn't mind the 1 minute, so we do 1 minute red, 1 minute near infrared. But a person can always shorten the treatment, like you say, or hold it back a little further.
Yeah, twice. Yeah, yeah.
Um,
Thank you.
so yeah, so even reaching TMJ, no problem. And like I showed, that you could just turn yourself or use the palm light, either way. James is mentioning one of the Golden State Warriors just had a torn patellar tendon. How do you pronounce that? You probably couldn't
Teller
pronounce.
tendon.
Okay, patellar tendon. Okay, well, somebody needs to tell him that he needs to get a light, right, Dr. Mindy?
Yeah,
Dale is asking, are all the gymnasts on the team using PBM?
they should be. Actually, one of his teammates had, I'm trying to remember what his injury was not long after that, but I got him using some PBM as well. So
They should be also, the Olympics are starting to do this now too, where they pre-treating before they get into a case where they're going to do their warm-ups and all that kind of stuff. And, so yeah. Okay. You don't have to. There's no requirement to use any other code. You just put in for purchases. You can just go on, and it'll automatically give the 10% discount. Okay. Jennifer is asking, can you use the palm device for cavities or receding a gum line? Thank you so much for all your knowledge and information. And where are you located?
me, I'm located in Iowa, in West Des Moines, Iowa.
Okay, all right. And what do you think about receding gum? I think she meant receding gum line.
So yeah, so once you've had recession, once that gum line has gone down, there's not the bone underneath it there, and so you won't get the gum line to grow back to where it is. But when you have a receding gum line, that's when the roots will be exposed, the more sensitive parts of the teeth will be exposed. So you're going to be prone to more sensitivity. So the red near infrared will be very, very helpful with any of the sensitivity you're experiencing. It'll be higher risk of decay. Those more porous areas of the tooth are higher risk of being decayed. This can also help with that. The more you can stimulate those mitochondria and the cells inside that pulp tissue, the more they can lay down reparative dent and reparative tooth structure to help with all of this. Can they fix a cavitation in the tooth? No, they won't make the cavitated tooth structure come back, but they can help if you have like an early incipient cavity that's still reversible. That can help, because that can help the tooth lay down some reparative structure so it cannot advance into the point that it's gone too far and become a full-blown cavity.
Okay.
I hope that answers the question.
Thank you. So a person is asking about is there help for a person that has had double jaw surgery twice? I own the palm model and have receding gums and pain. My condyle is deteriorating. So what do you think on that one?
So with the deteriorating condyle, you know, whichever side that's on, or if it's bilateral, both sides. But I would treat just right kind of, it's right, your jaw joint is right in front of the ear. So getting this centered there, and doing a minute of red, 3 of near infrared. The reason that the near infrared is the wavelength that's going to penetrate deeply to get into that joint, deep areas where the problems are. But I love the red first because it's going to stimulate the blood flow.
Exactly.
Blood flowing through there and really get things fired up. You're gonna get more bang for your buck with the near infrared if you start with a little bit of red first, in my opinion.
I agree with your opinion. Yep. So can you, okay, yeah, and we just answered that question, Greg. Can you do the near infrared without the red first? And I think I agree with you 100%. Do the red. That question came in 10 minutes ago, so they didn't know our answer before we got to your question. So thank you very much. We've got a lot of questions here. I'm going to try and speed up my. So Jennifer is saying, I've heard of great success with using it on your pet. Does it penetrate through the fur easily, or should they have it shaved? And I guess it really depends on the pet. If they have an extremely thick fur, that's going to be they're going to reduce a lot of light level that way. So then you might be looking like a thick black fur that's going to be high absorption. But we do have a special probe, a set that a person can order that allows you to kind of go into, wiggle it around a little bit. And it's like 8 of the oral probes that allow you to get lower between the fur and get light more into the area. So that's always possible. Okay, there's a question here from Michael. Hi, Mindy. Did you have any luck doing tissue regeneration and bone grafts for 9? We did. We just mentioned that earlier. 9-tooth, better healing and mitochondrial stimulation. Maybe he joined us a little late because we did talk. There was another question earlier that we had similar to that. Yeah, you've seen beautiful stuff with bone growth and bone grafts and things like that, right?
Absolutely.
And
we had to do to stimulate those cells.
We had one woman that had a bacterial infection that had taken place, and they did all kinds of things, but she lost a huge part of her bone, a lot of bone loss in her jaw, and she was able to improve the jaw again. It was a long time, but there was a lot of bone growth that took place over time on that jaw. They had the x-rays to show how much it did, how much it helped. So it was interesting. But speaking bone growth, one person, this goes back a long time ago, but the guy crashed his bike. He flew over the handlebars. He's a cyclist and broke a number of his ribs. And because he's a research guy like me in many ways, he was in a lot of pain, and he immediately used the light. They had the x-rays to show that he had broken his ribs. And 1 month later, he wanted to see the next day, after he did a light treatment for 1 day, the next day he was able to ride his bike again. I don't know if I'd be that daring to try it again. But he did, and he didn't have pain. 1 month later, he went in and just said, hey, I want another set of x-rays to see how things are going. And the x-ray technician could not see any evidence of cracked ribs in the exact location where they were definitely cracked before. So the healing was so complete. I imagine when you're saying about the tongue tie, one of the big things is that you're going to really help reduce the possibility of scar tissue forming, right?
That's the biggest thing. Yep, absolutely.
If you can get rid of that scar tissue forming. I remember one young teenager, she had was swinging around in a tree with her friends with a rope, and she jumped out of the tree only to have the rope lasso her hand and tore off the tip of her finger, her longest finger. And so they had to shorten the bone and then tie it together, the tip. And when they did that, the surgeon said, look, there's going to be many more surgeries to make sure I get rid of all the scar tissue that's going to be there. Well, immediately she was using the light therapy. And when she went up in for the 2-week follow-up, he says, I can't believe how nicely this healed. And there's no reason for any further surgeries because there is no scar tissue that he could see. Isn't that beautiful? That's the way every surgery should be done, with light. So
I just had a quick comment on that. Ann Liebert talks about rescuing DNA in an acute injury. She had a shoulder injury, but you have 45 minutes to 2 hours after that acute trauma. That's your golden window to start to get the LED, the red, the near infrared light on that area that was damaged. Just move fast. I just wanted to mention that.
Well, thank you. Yes. And in that case, if somebody out there wants to place an order because of an immediate issue, you got to tell us so we can make sure that we get it on the fastest way to get to you, right? So that we can get it into your hand.
If your neighbor has the LED, I mean, don't waste time.
That works good. Yeah. So any neighbors around Dr. Mindy or Dr. Naser, they're loaning out their lights too. No. It's funny, the number of people that have the wherewithal who have loaned out their light only to find out they need to buy another one because they've loaned out their light to all their friends. So that's kind of funny. Let's see. Would the palm unit, this is Susan, would the palm unit help with regrowth of gum tissue? I had a graft from the roof of my mouth to the gum below my front teeth, and now I am told I need it again.
So the tissue, if there's an area that you've had a graft, the bone isn't there to support the tissue anymore. So the tissue won't be able to regrow on its own. What the palm will be very, very helpful with is if you need another graft, my assumption is there had been some inflammation and you probably lost some of the graft material, some of that height, some of that coverage, or maybe it's the tooth next door to it that needs it now. But the palm device will help that graft heal in and solidify really well. And then using that kind of as maintenance will help keep the inflammation down, to help keep the health of that graft, to help keep that to be functional and lasting for you.
Okay, it just came as a reminder to me. One of the very first cases that I used the light on well, I guess it wasn't exactly the first, but it was right in the very early days. I would say within the first few months of having my light, one of my first lights about 20 years ago. A government official was looking at amputation of part of his foot because he had been in a plane accident and frostbite. They had to cut off part of his foot because of the frostbite. And what happens is sometimes grafts, when they are very old, start falling apart. And that's what happened in his case. The graft, which was doing very well for, I think it was 25 years or whatever, now was not, he was looking at another amputation. And he used my light religiously for a couple of weeks, and everything grew back together. It just all started coming back nicely together, and he didn't need that surgery, And I can tell you another person, a neurosurgeon. He had lost the skin on the bottom of his foot right behind the toe, and he tried everything for 2 years to try and heal that foot. And in 3 weeks, he was able to finally have the skin come right back around and reconnect and heal the whole area. So yeah, it's pretty amazing the things that light can do, especially when you have the right type of light source. And so you know what, we're going on for, and I cannot believe how many questions there's still. And I don't know, are you good for another 5 minutes, Dr. Mindy?
Yeah, that's fine.
Okay.
My son's calling, but he's fine.
Okay, all right. How old is your son?
He is 11 now.
Okay, all right. Yep. Well, Mom's busy.
He knows what I'm doing. I told him I was doing a webinar about the pulse device.
Okay, so Susan, if you want to respond back, how old is your mother? I think it was 101 years old, and she's using the palm light on her eyes every day, is what she's commenting to. Okay, there's a question here about your studies, Dr. Nasser. Where's the easiest place to find them? I think that would be on PubMed, wouldn't it?
Well, it is, but it's also on your website.
Yeah.
SunPowerLED.com. And
yep.
you have it set up by year, though. But can they just type in Nasser and there?
Yeah, they should be able to find it that way. Yeah, okay. Yeah. So, and if not, you're always welcome to send us an email to info@SunPowerLED, and we'll make sure we get some of Dr. Nasser's.
Yes, then I can also send you the paper. Yeah.
Okay. All right. Thank you. Yeah. Thank you. Can PBM also help with dental infections?
Absolutely. It absolutely can. It's not going to make the infection go away. If there's a dental infection because the tooth is necrotic, that necrotic tissue inside the tooth will not be able to regenerate. It becomes overridden with bacteria. But what it can be very helpful with is around extraction time. If you have a device, do some PBM the week before, get that blood flowing, get everything working, get your body fighting that infection a little bit more, get the tooth out, and then do it after. I would wait. I'm sorry, my kids are calling again. I would wait about 3 days before you do the red after the extraction, because you don't want to increase blood flow in that very early part. You want to get a nice stable clot there. But after a few days, then you can start that up, and that will help with the healing so very much.
I did have a woman on a long time ago. She had some teeth that were actually she's dealt with it a couple times where she's had a few abscess. Now, maybe it was the early part of the abscess or whatever, but she was told, oh yeah, you got to have a root canal. And in her case, she used the light and she was able to avoid it. Pain went away, and there was proper X-ray.
I bet she had more of a severe pulpitis. When it reaches abscess, then the infection is in the bone outside of the tooth because the infection is filled out.
All right.
But before that, it can be very painful when you have an irreversible pulpitis. I bet during that time that the photobiomodulation could help.
Okay. All right. And I have had some people, it's really funny. I was at one time I was asked to come over to a person's house, and they wanted to have just a little miniature meeting on the light therapy. And the one guy was extremely skeptical. He says, oh, that's not going to, how does that going to work or whatever? And his wife says, well, it helped me with this and this. And their friends who they invited over, she says, well, I right now have quite a bit of pain in this one tooth or something like that. She says, so she put the light on there, and he says, oh, come on, you're going to tell me that the pain is going to reduce? About 15 minutes later, she says, there is no pain there that I can, I'm not feeling it. And he was like, oh, come on, you're just saying it just to be nice to this guy. And no, she says, I don't have any pain there. We've seen that like for different other areas of the body as well. So it's kind of fun.
It can help, because when that pulp tissue inside the tooth gets inflamed, it's in a very hard root that cannot flex, and with inflammation becomes increased blood flow. So that extra pressure brings a lot of pain. When that light can help bring down that inflammation, that pain can go away because you don't have that pressure anymore.
Yeah. I think we're going to wrap it up now, but I do see if you have some questions that remained unanswered. I do see a number of people saying thank you for being on tonight. Dr. Nacer, thank you so much for being on. Dr. Mindy, thank you for being a first-time guest on our podcast here. It's been tremendous. I think it really helped people to understand what this can all do. This is fantastic. Thank you so much for being on, and I hope that all the God's richest blessings on your lives. Thank you for what you're doing, because I do believe that it's podcasts like this that are going to help reach millions of people, not necessarily directly, but indirectly. Somebody will tell somebody, and it goes pretty fast after a while. So thank you.
Thank you for having me.
Thank you very much. And so just to everybody out there, thank you for joining us tonight, and hope you have a great week. And next Tuesday, we will have another video webinar. I'm not sure who's going to be on tonight yet, or at this point, but we will get it out there. Thank you, everyone. Bye for now.
Thank you. Bye-bye.